According to a Berkeley Institute of Governmental Studies poll, most registered California voters want changes to the way emergency services respond to 911 calls. Only 12% of respondents are in favor of leaving 911 services as they are. A majority of voters believe that law enforcement is unprepared to handle mental health and homelessness crises, the situations in which emergency response services are most frequently needed. Public health advocates commissioned this poll because it believes the system needs to be updated. The First Response Transformation Campaign, who is responsible for commissioning the poll, details the importance of reimagining our response systems. For Public Health Advocates, I'm Jessica Castellanos. Welcome to the PHA Radio Podcast. Can I please have you introduce yourself?
I'm Harold Goldstein, the Executive Director of Public Health Advocates.
My name is D'Angelo Matt, and I am the Director of Equity Justice with Public Health Advocates.
My name is Ryan McClinton, and I am the Program Manager over our First Response Transformation Campaign at Public Health Advocates.
My name is Christina Gilardi, and I am the Director of Research and Learning at Public Health Advocates.
My first question is, what does the poll say? What is the most interesting part for you?
Jessica, there's been a growing national concern about harm, sometimes even fatalities, caused by police responding to mental health crises and other non-life-threatening situations. And in the midst of that, we, public health advocates, we commissioned a public opinion poll to find out how California voters feel about our current emergency first response system, our current 911 system, how they feel about that in their community. And the results were really startling.
FRTC stands for the First Response Transformation Campaign. It's a campaign we began moving around 2020. The thought of how do we reimagine first response? Public health advocates thought we needed better support for community, specifically the most marginalized community, around how we're responding, who was responding to first response situations. And the First Response Transformation Campaign was designed to support cities around technical assistance as they're standing up alternatives to emergency response. I think we had an understanding that in recent years, individuals in California wanted alternatives to just police arriving at certain situations. I think what's more shocking is the actual numbers of those individuals. We know that the poll speaks to about 90% of residents who took the survey or took the poll want some type of alternative than just police arriving to the scene. And so I think the stark call and number of individuals throughout the state is the most interesting part.
There are a number of really interesting pieces of the public opinion poll, and probably most striking is the number of and the percentage of California residents who are really interested in seeing first response systems do something differently. So 88% of Californians are saying that they want to see something done in a way that it's not currently done. That includes almost 70% of Californians saying they'd like to see more access to behavioral health and social service providers responding to common crises across the state.
Yeah, the poll actually is a very telling response of where California residents feel we should be going in the direction of first response. First response has a history of being primarily around fire, police, and EMS. And as the diverse needs of our community go, our community recognizes so should the response. Largely what we saw from California voters and residents is that they want to see someone different respond to some of the quality of life calls that we see happening. Mental health, substance abuse, homelessness, quality of life calls that, again, skilled social workers, mental health professionals, peer specialists would be better equipped to respond to versus law enforcement who tend to be trained to respond to laws and crimes and think potential for harm taking place. We've seen a lot of harm through Black and brown bodies and residents of color with the wrong response showing up on the scene. We've seen people lose their lives at times in ways that they shouldn't have because of the perception of what was happening in the moment, the inability to pivot to something different in your response at the hands of law enforcement, even firefighters. Here locally in Sacramento, there's a story of a man who ended up dying because they didn't respond to his needs in the moment with 5 firefighters surrounding him at the time. And that just can't happen, right? It's those things of the perceptions of your daily work and sometimes the trauma of that work that exists that residents are recognizing. I don't feel safe having to call this response where that can be the outcome for my loved one or this person that I may not know, but know needs help. I've been in the situation of having a sibling having a mental health crisis and literally driving across town trying to figure out where can I take her to get the care and services she needed, and not having that available. And the only resort I had was to call law enforcement, which thankfully, because of the work I do, I knew who to call to say, hey, this isn't the specific response I need. And I couldn't get that. But what I did get were officers who were willing to at least be hands off and take direction of what do you need to make sure ultimately that safety's here and that harm doesn't occur. But we can't do anything unless it's at that level. So I still felt very helpless in the moment of providing for my sister. And I realized this isn't still what I prefer to call. I was very scared and worried to call. And I seen the fear on my mom's face in knowing that. So where I have that personal experience, we see these personal stories that are local to us, to see overwhelmingly throughout the state that many people feel that way, that's a big impact that we have to do something. And the time to do something different is now. And I think that California voters and respondents shared very clearly what that prioritization should look like.
Thank you for sharing that very deep and personal story. I know that it's not easy, and I appreciate you being so forthcoming in this space.
You know, our 911 system was established 55 years ago in 1968 as a one-size-fits-all system for all emergencies, fire and medical and police. You know, today, Californians make more than 25 million 911 calls annually, but increasingly, the public is relying on 911 for immediate assistance to non-life-threatening situations. So it's time for us to update the system to make it more effective and less costly.
Neighborhood Change Champions is a youth-driven advocacy campaign that works to create policies to reduce health disparities and improve healthy outcomes for selected census tracts in San Joaquin County. If you're a young person between the ages of 13 and 18 and live in Stockton, Manteca, Lodi, or Tracy, now's your chance to make a difference in your community. Find out how you can be a part of Neighborhood Change Champions today.
Why does this matter?
This matters because I'm a Black man in America. And for so long, I've seen the wrong responses in situations like this in my own personal life and with my own family. The histories with my life and my family around mental health and the need for services just need an appropriate response. And it matters because even more so today, we are identifying that issues that we are seeing in neighborhoods, at homes, in the streets are less violent and more dealing with the woes of today, right? The pressures, the hardships of today, right? We look at the disproportionate number of individuals, Black and brown specifically, who are unhoused, right? That speaks to where we are today. We look at the disproportionate numbers of people who are affected by mental health issues, that these things need a different response. And I'm not saying that these issues weren't present years before. Growing up, we did not have a voice in articulation to explain where we were. But I also know that things have intensified and things have elevated. And so we see a tremendous amount of the numbers being greater today than years past. These issues definitely need individuals who are not only trained for this work, but understand and are empathetic to the needs of the folks calling for service. Law enforcement has a job to do, and that is to support residents around violent crimes. We know that they are not trained to do certain work that they're doing. We know that they don't want to do the things they aren't trained to do, and we support that. And the poll basically shows that the people support that and want them to actually do their job, right? Which is to deter violent crime, but need and desire and truly want a resolution, something different that better supports the actual issue that they're calling for outside of these violent crimes. And so it matters because we've been calling for it, standing on our soapboxes in our heels, screaming to whoever would hear it, we as in the collective community, that we need something different.
Thank you for that response.
It's always hard to follow D'Angelo Merrick in a answer like that, but my brother said so many of the points that are true for me too. Being a Black male in this country, in this great country of America, where we see great diversity in our people, our cultures, ethnicities, and communities, yet we also see great disparity in how equity is dispersed and how safety looks and how care, concern, and thriving looks and how resources are. As somebody who lives it daily, I think one of the greatest gifts that I've had in my life is being able to recognize the role systems have played in either my accessibility or my inability to get access.
With so many 911 calls being about people who are having a mental health crisis or who are homeless, not every response needs a firearm or a fire truck. Those are expensive and unfortunately can end up even being dangerous or mistakenly even fatal. Most voters, 2/3 of voters, want social workers or specially trained community health workers to respond to those non-emergency calls, either with or without law enforcement. It could save money and it could be a lot safer and more effective to have non-law enforcement folks responding sometimes.
In recent years, we've seen a reckoning across the country of people standing up for justice in the moments of crisis, right? Because of social media, people are more exposed to the dangers of law enforcement responding to crises that they're not well equipped to handle. Although communities have known this for a really long time, it hasn't really hit the national attention in the same way. And we're seeing that regardless of race and ethnicity and a whole host of other demographic pieces of information, that people are really saying something has to change and we need to be responding to crises with the providers who have the skills and the expertise of the crisis involved. I think for law enforcement, it also is really important because they have been reporting across the country that they're understaffed and working lots of overtime. And what this would do would actually reduce the workload and the expectations of law enforcement to be responding to calls that they're not well equipped to respond to, freeing them up to respond to things that they're actually trained for and went into the field to do.
Public health advocates' REACH program, Safe Routes to School, is a movement that aims to make it safer and easier for students to walk and bike to school. Speeding cars, lack of stop signs, and lack of awareness are some of the biggest threats to children's safety. Smaller children can have difficulty seeing surrounding traffic. They may also not be seen by speeding drivers. It is important not to expose children to traffic dangers, so we need to advocate for children's health and safety. We can reduce risk by setting up access to more traffic lights, speed bumps, education, and crossing guards. But we cannot do this alone. Your community can benefit from Safe Routes to School. You can join the countless communities that are changing how their streets look and work. To learn more about how you can transform your neighborhood, visit phadvocates.org or contact Isabel Perez.
What is your personal connection with the work?
I have been supporting the First Response Transformation Campaign with their research components of their work and helped to lead the public opinion poll. So the development of the questions, the partnership with UC Berkeley, and then leading the team through the process of interpreting the data. Currently, I'm also supporting the First Response Transformation Campaign cities, Sacramento, Stockton, and the northern part of San Diego County, to understand their local data so they can use this at a local level to inform change and create new policies at the city or county level.
We have a class and a population of people who are missed and not getting what they need. So what do you do when you don't have something? You try to fill the gap. You try to become the solution. I'm just doing it because it's what my community needs. It's what my family needs. It's what our people need. And when I seen it across that, those issues were magnified when we look at not only different ethnicity and cultures, but subset cultures of our community. Oftentimes we don't talk about our LGBTQ family, our trans family, right? And how they're impacted by mental health and substance abuse and homelessness and challenges across the board and even physical harm. Yet, if we don't see them even in our own communities, what do you think the systems that are responsible for our care and wellness are doing or not doing for that matter?
Leaders in America's largest cities are now acknowledging the need for a change to the emergency response system. Even in a place like the city of Los Angeles, the largest employee union, the largest police employee union, has identified more than 24 types of 911 calls that could be routed to other city agencies. And we, as a public health organization, see a lot of opportunity to make our current 911 system more effective and more efficient. And there's a lot that can be done.
This country has a deep rooted history in oppression and abuse when it comes to Black people and people of color. It's a very personal issue to me because I live it, I deal with it. I have to teach and share with my daughters and people in my community how to protect themselves and how to move forward against systems that are oppressive. And it's an issue that I do this work because I live this work. I live this work because I do this work type of thing, right? It's interchangeable in that way. We don't have the ability to turn this off. We are in the trenches supporting brothers and sisters who are most affected by these things. And we come home and have to deal with those same things ourselves. It's no off switch for a Black person or a person of color in this country when dealing with racist systems. This is why I do the work to lift up the voices, just like this poll is saying, is not necessarily just people of color who have taken this poll. It's voters of all backgrounds, races, and voting demographics. But to the question of, for me, it's life. It's everyday life. It's every hour life. It's every minute life for me. And as long as I have the breath in my body to do so, I'm going to speak on it.
Public Health Advocates is a leader in addressing major threats to public health throughout California. Through our role as an innovative nonprofit organization, we work to create better public policies at all levels. We give people information they need to make healthy choices for themselves and their communities. For more information, visit www.phadvocates.org.
What should come next after the release of this data? What do you think are the next steps?
We see three major changes that could happen. First, we think that there needs to be a lot more transparency in the data. Right now, 911 data is not publicly available. So if we don't know what the data says, how can we possibly improve the system? So it's time to make that 911 data publicly available so that we can look at what the current calls are and who's responding. Second, there need to be in every community, there can be alternative response programs like those in cities all over the country where law enforcement response is a last resort, not a first option for nonviolent episodes like mental health crises, calls about people who are homeless. And then third, communities can have an independent dispatch agency. So rather than having 911 led by either police or fire or emergency response or emergency medical, rather than having the 911 call center led by police or fire or emergency medical folks. It's much better to have it led by an independent group so that the responders aren't biased toward police or fire. So 3 things: getting the data that's needed to be able to examine the current system so it could be made more effective and more efficient. In every community, some alternative response programs so that it's not just police or fire that are responding to non-emergency calls. And third, every community having an independent dispatch entity.
I'd really like to see a really rich conversation with local elected officials who have the ability to shift resources and budgets to align with what communities are asking for. So they're asking for access to behavioral health specialists and social workers in moments of crises that most cities and most jurisdictions don't actually have access to at this point in time. I'm hoping that local advocates can take this research, put pressure on their local governments and their law enforcement to reimagine what public safety means in their community and how best to respond to crises.
We saw a presentation at a council meeting last night where they highlighted law enforcement gets 2,300 hours of training to be a officer, a peace officer, right, around crimes and law enforcement and those nature things. There's a similar story for social workers, right? Oftentimes they have to get a master's degree to handle mental health cases, right? Social challenges, right? To make sure that they're connecting with the individual they're seeing to make sure that they get the right care plan. So why do we have somebody who's not being trained in that same way responding to those calls, or we have a whole field of people who are trained to, but not being equipped to be the first responder in those situations? That's what this data is telling us.
Next steps are obviously reviewing, right? Folks are going to want to review the data and get information and clarity around it. But directly after, change needs to happen at the most local level and at the state level. And quite frankly, as we're moving even further at the national level, this information is something about elected officials for me and why they've chosen to take an oath and do the job they've chosen to do. That oath and reason on why they've chosen to do what they do, they often say, quoting elected officials, is to take on the issues of the people, right? To hear the voice of the people and to respond to their constituents. This poll basically is their constituents saying, do something. We've spoken and we're asking for some, like Ryan said, fundamental change in the way we do emergency services. What should happen is the folks with power and privilege should see, hear, and listen to this data and then respond by acting on this data.
Training phenomenal points, and I want to build on that because I think along with the review of the information and really digesting it to understand what it's saying and who's saying it and where it's being said at, the elected officials have a responsibility, as do the department heads and chiefs that are operating these systems. And we talk a lot about big P being the policies that are governed by our elected officials, but there's a small p that's governed by our department heads and the leaders and chiefs of those divisions, and the practical changes they can make right now to start shifting some of those dynamics.
In the past 3 years, while we've been in a deadly pandemic that caused record job loss, homelessness in California went up by 15%. California now has about 175,000 unhoused people, and they're disproportionately Black and Indigenous folks. We see it in our cities, where rent has skyrocketed. The shortage of low-income housing is the main cause of our homelessness crisis. We must fight for more housing while understanding it won't all be built overnight. So today's question is this: if we know that we don't have nearly enough homes, why do we show so little compassion for our unhoused neighbors? Go to a city council meeting. You might hear your neighbors and elected officials talking about unhoused people as if they're less than human. Look at the policies that seek to push them out of sight and warehouse them in small spaces with no plumbing. It's like we don't think it could happen to us. We could never be homeless, right? Wrong. Most of us are this close. one medical bill, one disaster, one pandemic away. It's time to lend a hand to our unhoused neighbors with more resources and services, and stop more people from losing their homes. Homelessness is the crisis of our time in California. We need all hands. Learn how you can help. Go to thisclosetounhoused.org. That's thisclose, 2, unhoused.org.
Thank you for your time. I really appreciate this space with you, and thank you for all of your words and being so forthcoming.
Thank you, Jessica, for allowing us the space to share. I just appreciate the building on the greater understanding of the need. I just hope that folks who hear this, who are experiencing these situations and agree with this change, this improvement in responding alternatively, will keep up the fight, keep lifting your voice, and keep pushing the needle of change and advocate for your support, the support of yourself and your family, and your community. Be encouraged that there are things that are going on behind the scenes that you may not see. And it's because of your voices. It's because you continue to lift up what you're experiencing and how you're experiencing it.
Public health advocates created the First Response Transformation Campaign to support cities in reimagining first response and to provide technical assistance as they stand up alternatives to traditional emergency response. Through their work, a survey was commissioned to find out how California voters feel about the current emergency first response system. The poll shows that California residents want to see social workers and mental health professionals respond to quality of life calls versus law enforcement. This story was executively produced by public health advocates. Thank you to my guests, D'Angelo Mack, Ryan McClinton, Harold Goldstein, and Christina Gilardi. The music was provided by Pixabay and the podcast host. For more information on the First Response Transformation Campaign and other campaigns, visit www.phadvocates.org. I'm your host, Jessica Castellanos. Thanks for listening.